Imagine a world where poverty is eradicated, quality healthcare is accessible to all, and our planet thrives for future generations. This is what the Sustainable Development Goals, or SDGs, aim to achieve by 2030. Adopted by United Nations in 2015, SDGs provide a universal blueprint for a more equitable, healthy, and sustainable world. Hello everyone, I am Dr. Alisha Manandhar, and today I'll take you through SDGs' significance, impact, and our collective role in turning these goals into reality. Talking about Sustainable Development Goals, or SDGs, knowing about them is not only important from our exam point of view, but also for our general knowledge as global citizens. So let's start our Community Medicine Capsule series, session 2 on Sustainable Development Goals today. So today our session is on Sustainable Development Goals. So first let's see, what do SDGs mean? SDGs, or Sustainable Development Goals, means there are a total of 17 global goals with 169 targets and 232 indicators adopted by all United Nations member states in 2015 as part of the 2030 Agenda for Sustainable Development. So what do you mean by targets and indicators? Let's see. So targets here means those which are specific, measurable objectives under each SDGs. That is, under each Sustainable Development Goals, there are specific and measurable objectives which we call as targets. So another thing we have under global goals is Sustainable Development Goals is indicators. So indicators means those metrics which are used to track progress. So as I've shown here in the screen, indicators means metrics which are used to track progress. So what happens is, so broadly there are Sustainable Development Goals, or SDGs, which are 17 in number. So under these there are targets and indicators. So there are a total of 17 sustainable goals under which there are targets and indicators. Now let's see our second slide. So what is the aim of Sustainable Development Goals? The aim of Sustainable Development Goals is to address global challenges like poverty, inequality, and pressing health issues, climate change, peace, and justice. So what is it? The aim of SDGs is to address mainly global challenges such as poverty, inequality, pressing health issues, climate change, peace, and justice. These are not only limited to these certain aspects, but these are limited to much more than those. But more important ones are what SDGs actually address are global challenges like poverty, inequality, pressing health issues, climate change, peace, and justice. So coming to our main topic, Sustainable Development Goals, how did it all begin? So there was first Alma Ata Declaration in 1978. Alma Ata Declaration was primarily for primary health care to achieve health for all by 2000. But later, in 2000, Millennium Development Goals were put forward. This was basically like to achieve universal health coverage, for accessible and equitable world, and to reduce poverty. For to address these issues, Millennium Development Goals were brought forward in 2000. But then Millennium Development Goals were found to be more like too narrow, because they were mainly focusing on developing countries. So again, building on the successes and the challenges and the lessons that we learned from Alma Ata Declaration and Millennium Development Goals, in 2000, Sustainable Development Goals were put forward by United Nations. So it has, then came the Sustainable Development Goals in 2000, building on to Alma Ata Declaration and Millennium Development Goals, which has 17 goals, 169 targets and 232 indicators, whereas MDGs had only 8 goals and the Sustainable Development Goals were realized to be more more equitable, like working more properly, and they could bring more impacts on in the global world than Millennium Development Goals. So let's see our key MDG achievements, like what could the MDGs achieve, Millennium Development Goals. So Millennium Development Goals could achieve, like, more than 1 billion people have been lifted out of extreme poverty. That is, 1 billion people have been lifted out of extreme poverty since 1990. Next is child mortality dropped by more than half since 1990. The number of out-of-school children has dropped by more than half since 1990. HIV/AIDS infections fell by almost 40%. Since 2000, HIV/AIDS infection fell by almost 40%. And Millennium Development Goals started a global movement for pre-primary education, inspiring countries to invest in their future generations. So these were the key MDG achievements, that is, Millennium Development Goals could achieve these important things. Then here I have tried to show what the MDGs or Millennium Development Goals could achieve as a whole in the world. And since we know there were 8 Millennium Development Goals, there were 8 goals in MDGs. It is not possible to include what each goal could achieve, but I have tried to at least give you a snapshot of what some important goals could achieve, like what the MDGs could achieve in the world. So I have included here number 4, that is MDG 4, reduce child mortality. So what could MDGs achieve in the world in terms of goal 4, that is reduce child mortality? The global under 5 mortality has declined by more than half, dropping from 90 to 43 deaths per 1,000 live births. So in case of MDG 4, that is Millennium Development Goal 4, reduce child mortality, the achievement is through MDGs, the under 5 mortality rate would be declined from 90 to 43 deaths per 1,000 live births. Next is, despite population growth in the developing regions, the number of deaths of children under 5 has declined from 12.7 million in 1990 to almost 6 million in 2015 globally. So this is yet another achievement which I have tried to show here, that is from 1990 to 2015, the achievement is from 12.7 to 6 million. About 84% of children worldwide received at least 1 dose of measles-containing vaccine in 2013, up from 73% in 2000. That is, global measles vaccine coverage rate also increased by MDGs, would be increased by MDGs. That is, from 73% to 84%, there was a spike in the coverage, which is actually commendable. So now coming to our next Millennium Development Goals, that is Goal 5, which says, Goal 5 here, which says improve maternal health. So what were the achievements that Millennium Development Goal 5 could achieve in the world is, since 1990, the maternal mortality ratio has declined by 45% worldwide. And the most of the reduction has occurred since 2000. I have shown here in the chart here. And another achievement in terms of improving maternal health, which is done by Millennium Development Goals, is more than 71% of births were assisted by skilled health personnel in 2014, increasing from 59% in 1990. As you can see here, it is 59%, that is global birth attended by skilled health personnel was only 59% in 1990, whereas it spiked to 71% in 2014, which is a very good progress that MDGs could bring. So you people must be wondering, the topic today is SDGs, so why I am talking about MDGs? it is important for us to know what could MDGs achieve and what they could not achieve, and what were the certain background that MDGs created in the world, and building on those successes and challenges and the lessons that we could learn from Millennium Development Goals, then were the SDGs formed. So it's really important for us to know at least certain part or background about Millennium Development Goals as well. So I've tried to give a short snapshot of what the MDGs could achieve in the world, and building on to those, SDGs were developed. So now coming to Millennium Development Goals again. So the achievement that Nepal could make in terms of reducing child mortality, that is Goal 4, Millennium Development Goal 4, reducing child mortality. So what achievements were made in Nepal? So you can see here in the slide, achievements on reducing under 5 mortality in Nepal, that is from 1990 to 2015, what the target 4 could achieve. These are the indicators that I've listed here. That is, in terms of target 4, reducing child mortality, its indicators are 4.1, 2, and 3, as I've shown here. That is, infant mortality rate, under 5 mortality rate, and proportion of 1-year-old children immunized against measles. So what are the achievements that Nepal could make in terms of these indicators is, so coming to our indicators, let's see. In 2015, so our all targets are achieved, as we can compare here in the slide. These are the targets, and these are what Nepal could achieve. That is, all our goals have been achieved in 2015 in terms of reducing child mortality. That is, infant mortality rate has been achieved, under 5 mortality rate, and proportion of 1-year-old children immunized against measles. So all these targets could be achieved from the Millennium Development Goals in Nepal. So coming to our next goal, that is Goal 5, improving maternal health. So let's see what Nepal could achieve in terms of Goal 5, that is improving maternal health. So we can see here in the screen, I have shown here in 1990, data from 1990, 2014, and comparing them with 2015 targets. So the goal here is partially achieved. And I have taken all these information from MDG Status Report 2016 of Nepal. So you can go through those if you want more details on this. So let's see what were the strengths of MDGs based on which SDGs were developed. So the strengths of MDGs are, they were simple, clear, and time-bound framework. They were successful in attempting international target setting in the field of development, the progress towards poverty eradication, women's empowerment, health, and education. There were progress towards poverty reduction, women empowerment, health, and education, and MDGs encouraged investments that led to innovation and interventions. And MDGs also helped improve country data availability. So in terms of data also, the countries were strengthened by MDGs or Millennium Development Goals. So let's see what were those were the strengths of MDGs. So what were the limitations of MDGs? Like based on these limitations also, they were also kept in mind while SDGs were, Sustainable Development Goals were framed later on in 2015. So the limitations we can see is the poorest and hard to reach population were left behind. In Millennium Development Goals, the poorest and the hardest reach populations were left behind, and they focused mainly on attaining a particular goal at the expense of others. So they could not be more comprehensive and inclusive. And then the Millennium Development Goals were applied as one-size-fits-all planning instruments that every country can meet, but it was less useful for countries in a conflict situation. So since they were less useful in countries in a conflict situation, it was necessary that SDGs had to come forward. Now let's see the transitioning from MDGs to SDGs. So by now you have at least a little picture or sketch of what the MDGs were, what they could do in the world and in Nepal, and what were those strengths and the limitations. So building on to those aspects, those strengths and limitations, we can now see why the SDGs were formed and what could they do, what the MDGs could not do, and what else could the SDGs build on in terms of with the SDGs. So transitioning from MDGs to SDGs, that is transitioning from Millennium Development Goals to Sustainable Development Goals. So coming to the brief background and how did it all evolve, Millennium Development Goals were from 2000 to 2015. So they focused on poverty, health, education, and gender equality, whereas Sustainable Development Goals from 2015 to 2030, they were more comprehensive and they were covering social, economic, and environmental dimensions. Endorsed by 193 UN member states. So this can be another probable question in your exams. So they were endorsed by 193 UN member states in September 2015, yet another question, by the UN General Assembly. So this whole line is a very important line because questions can be formed from this line. So it was SDGs were endorsed by 193 member states, UN member states in September 2015 at the UN General Assembly. And it is a universal call to action to leave no one behind. It's a very important line. So SDGs are a universal call to action to leave no one behind. So now coming to SDGs, that is Sustainable Development Goals, the global goals for sustainable development. As I have already mentioned previously as well, we have total of 17 global goals in Sustainable Development Goals. So for ease, we can divide them into economic pillar, environmental pillar, and social pillar. So under economic pillar, we have 5 global goals. That is, Goal 1, no poverty. Goal 2 says zero hunger. Goal 3, good health and well-being. It is a very, very important goal. Decent work and economic growth, Goal 8. And Goal 9, industry, innovation, and infrastructure. So we have a total of 5 global goals under economic pillar. So coming to environmental pillar, we have total of 6 global goals under environmental pillar. That is, Goal 6, clean water and sanitation. Goal 7, affordable and clean energy. Goal 12 says responsible consumption and production. Goal 13, climate action. Goal 14, life below water. And Goal 15, life on land. So another pillar we have is social pillar. It also has 6 global goals. That is Goal 4, quality education. Goal 5, gender equality. Goal 10, reduced inequalities. Goal 11, sustainable cities and communities. Goal 16, peace, justice, and strong institutions. And Goal 17, partnerships for the goals. So as you can see on the slide, we have a total of 17 goals in SDGs, and they can be again divided into different pillars. That is, they fall under different pillars: economic, environmental, and social. Under economic pillar, we have 5 global goals. Under environmental pillar, 6 global goals, and under social pillar, we have 6 global goals again, making a total of cumulative 17 global goals. So let's find out why SDGs matter. Why do sustainable goals, development goals matter? All 17 goals interconnect, meaning success in one affects the success of others. Since all these goals are interconnected and none of the goals work in isolation, 17 global goals are interconnected, meaning effect in one affects the success of others. That is, success of one affects the success of others. They address global poverty, inequality, and environmental degradation. SDGs provide a shared blueprint for peace and prosperity, and they promote global partnerships to tackle challenges. So, what are their relevance to global and local development? Let's find out. They align with national development plans. Sustainable development goals align with national development plans in each country. They address challenges such as climate change, unemployment, and educational gaps. And their roles in achieving a sustainable future is they balance economic growth, social inclusions, and environmental sustainability, and support human rights and justice for all. So here I have shown goal 3, that is ensure healthy lives and promote well-being for all at all ages. So we'll explore a more explore a little more detail on Sustainable Development Goal 3, that is good health and well-being, because this goal is extremely important for us from exam point of view. And by saying this, I don't mean that the other goals are not important, but for us, goal 3, we have to know about goal 3. However, all other goals are also equally important. So first, see what goal 3, good health and well-being, says. So goal 3 is good health and well-being, and it has different targets. First one is goal target 3.1, that is maternal mortality. So what does target 3.1 maternal mortality says is, by 2030, reduce the global maternal mortality ratio to less than 70 per 1 lakh live births. So what is the target that the goal target 3.1 maternal mortality sets is to reduce maternal mortality ratio to less than 70 per 100,000 live births. Goal target 3.2 is neonatal and child mortality, and it says by 2030 end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality rate to at least as low as 12 per 1,000 live births and under 5 mortality rate to at least as low as 25 per 1,000 live births. Coming to our next target, 3.3, infectious diseases. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. So, these are different targets under Goal 3, good health and well-being. We have seen what are the targets and what do they aim to achieve. That is 3.1, 3.2, 3.3. We have finished. Now coming to 3.4, that is non-communicable diseases. In terms of non-communicable diseases, by 2030, it aims to reduce by 1/3 premature mortality from non-communicable diseases, NCDs, through prevention and treatment, and promote mental health and well-being. Target 3.5 is substance abuse. So this says strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. Target 3.6, road traffic. So this target aims to achieve by 2020, I think it should be 2030, there's a slight mistake in the slide, half the number of global deaths and injuries from road traffic accidents. So these are the targets, and what do they try to what do they want to achieve also, I have shown you already. Target 3.7 is sexual and reproductive health. By 2030, ensure universal access to sexual and reproductive health care services, including for family planning, information and education, and the integration of reproductive health into national strategies and programs. So I have already said, in every country, SDGs are interconnected with national health policies and work closely with the nation's plans and policies. Target 3.8 is universal health coverage. What it says is it tries to achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Target 3.9 is environmental health. By 2030, substantially reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. So coming to our next target, that is under goal 3, we have means of implementation for the targets as well. That is 3.1 target says tobacco control. So what it says is strengthen the implementation of the WHO Framework Convention on Tobacco Control in all the countries as appropriate. That is FCTC control for tobacco control. So this is yet another important question. FCTC is related to tobacco control, that is Framework Convention on Tobacco Control. 3.B, medicines and vaccines. Support the research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries. 3.C, health financing and workforce says substantially increase health financing and recruitment, development, training, and retention of the health workforce in developing countries, especially in least developed countries and small island developing states. Another is 3.D, emergency preparedness. It says strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risk. Coming to target 3.8, universal health coverage. This target can be seen as an overarching one that supports the achievement of all the other targets, and it is derived from Millennium Development Goals, the new targets, and means of implementation. So these are the targets which fall under goal 3, that is good health and well-being, and I have also already explained you what they try to achieve, what are the targets that they have set. So I have included another slide on Sustainable Development Goals Status and Roadmap 2016 to 2030, published by the National Planning Commission. So you can go through this report if you want more details on this. Coming to the SDG committee, so you must be wondering how the SDGs are implemented and what are the different committees that are present. So there are National Steering Committee, Implementation, Coordination, and Monitoring Committee, and there are thematic working committees as well. So these are the two important bodies under which there are thematic working committees as well, as you can see in the slide, for economic development, social development, sustainable production and gender mainstreaming, agriculture development and drinking water, and coordination. These all works in a coordinated way with energy development and climate change, infrastructure development, and governance. So this is the SDG committee. Coming to the SDG provincial and local implementation mechanism, so how do they work? New district coordination committees will take the lead in coordination and achieving the SDGs at the local level. Then comes the SDG implementation committee, which will be established at the provincial level, district coordination committees, and municipality levels. Then they coordinate with the private sector, civil society organizations, development partners, cooperatives, and other non-governmental stakeholders for the achievement of SDGs. So what are the role of different stakeholders here? Because SDGs cannot be achieved by only one stakeholder or one civil society or one organization, but everyone has to work in a close-knit manner, close-knit circle, helping each other and supporting each other. So what are the roles of different stakeholders? Let's see. The government helps in the policy formulation and funding as well as monitoring aspects. Private sector helps in the investment, innovation, and corporate responsibility aspect. Then comes the NGOs and civil society, which again play equally important role in community engagement, advocacy, and building. Then comes academia and research institutions, which help in evidence-based policy making and training. And we as individuals and communities, we can help in grassroots actions, very, very important, behavioral change. Now let's see some of the case studies and the best practices that have come into play. So some of the successful SDG implementation examples that I want to show you all here is in terms of SDG 7, that is affordable and clean energy. So what are the successful implementation examples? Solar energy projects in Bangladesh. So in terms of SDG 7, affordable and clean energy, solar energy projects were established in Bangladesh. In terms of SDG 2, zero hunger, school feeding programs were established in Africa. In terms of SDG 13, that is climate action, Nepal's community forest programs can be taken as successful SDG implementation examples. In terms of, now let's see what are the lessons learned from sustainable development goals. So multi-sectoral collaboration is a key. So from SDG implementation, the lessons that we have learned is multi-sectoral collaboration is the key. There is need for continuous financing and political will. So the lessons learned are multi-sectoral collaboration is key, and there's need for continuous financing and political will should be there. So the strategies to accelerate SDG implementation. So what are the different strategies that are there to accelerate SDG implementation? Let's see. In terms of policy and governance approaches, strengthening national SDG frameworks, increasing investment in social and environmental sectors, the role of technology and innovation. So what are the different strategies that can be used to accelerate SDG implementation in terms of role of technology and innovation is AI and data analytics for SDG monitoring. So artificial intelligence or AI is playing a very major role in the world today. So AI and data analytics for SDG monitoring is very, very important. Renewable energy adoption, yet another very important aspect. Multi-sectoral engagement. So in terms of multi-sectoral engagement, what are the strategies we can use to accelerate SDG implementation? It is cross-sectoral partnerships and empowering youth and marginalized communities, as well as calling for urgent action and policy changes. So what are the challenges in achieving SDGs? So let's look into some of the challenges that are there in achieving the SDGs. Some of the global challenges are climate change and natural disasters, global conflicts and pandemics such as COVID-19. I don't think I need to explain this because we all have gone through this pandemic and we know what are the difficulties that underlines in terms of the global pandemic situations like COVID-19, like we ourselves underwent the experience. It was really difficult for not just an individual or a community, but whole nations and the world as a whole. Financing and economic crisis, financing gaps and economic crisis. And what are the challenges faced by Nepal in terms of achieving SDGs? So what are the difficulties? That is, the budget allocation is another aspect. Limited budget allocation for SDGs are creating hindrances in achieving it. The weak data collection and monitoring aspect, slow policy implementation and governance issues, especially in context of Nepal, where the political instability pursues continuously. It is another yet important aspect or challenges that the Nepal is facing, that is slow policy implementation and governance issues and graphical representation of bottlenecks, yet another challenges faced by Nepal. So as a conclusion, I would like to say certain points that I've included here in the screen. SDGs require collective efforts and long-term commitment. No doubt that SDGs require collective effort from all the aspects, all the stakeholders and individuals for long-term commitment. So everyone has a role to play in achieving the goals. So we all need to work hand in hand and in a close-knit manner. So how can we contribute as individuals? How can we contribute is we can reduce waste and adopt sustainable habits. We can advocate for policy changes, of course, and we can support SDG projects and innovation. So the final message that Sustainable Development Goals want to convey all of us is the future we want is a sustainable world for all. So this is the final message that Sustainable Development Goals wants to convey us. And these are my references. You can go through the references if you want any more details, because Sustainable Development Goals is really a very used topic, and if I go into details of each of the goals, then it will be really lengthy and tedious. So I have included the details of only, I could include the details of only goal 3, that is good health and well-being. Nevertheless, you can go through all the other goals and targets as well as their indicators and more details if you find it interesting through the references that I've listed out in my slide here. So thank you and keep supporting our initiative. And if you like what we are doing, then please hit the like button, subscribe, and share with your friends share with your friends so that they can be benefited. Thank you.